Welcome to our session today on how to use simulation and role-playing to teach powerful lessons on dementia and elder abuse. Keeping our most vulnerable aging population safe and cared for is very vital as more baby boomers age. But helping our students to understand just how important this is can be challenging, and it's not easy. So we're hoping to show today how 2 or 3 of our new programs and resources that we have, which harness the power of simulation technology, role-playing, and scenarios, will help students walk in the shoes of precious aging adults and really give them those aha moments on these very, very difficult topics. So here's a little bit closer look at what we're going to be covering today. I've got many, many different dementia and elder abuse scenarios to share with you. You will be able to take these and use them in your own programs as you see fit. We are also going to be providing some overviews of our elder abuse training kit, as well as our dementia simulation experience products and how you can use those as well. But we have tried to load this presentation with a lot of free resources and links to things that you can try in your own program. And of course, at the end, we will feature a Q&A session if you have questions on any of the things that we're sharing today. So using dementia simulation scenarios. And so here's a thought. We have a geriatric simulation suit. It's a wearable, and it can be a very effective tool to use in role-playing and also walking in the shoes of a vulnerable adult. And not all aging adults, of course, will get dementia, certainly, but the estimated average age of onset of dementia in the United States is 83.7 years old. So including an aging simulation suit along with a dementia scenario can really create an even more realistic experience. And we have provided the link to our suit up there. However, if you wanted to create your own DIY aging suit, some of the things you could do would be to gather wrist and ankle weights, weight vest, braces, ambulation aids like walkers and canes. And you could also do a low fidelity version yourself and also be able to help your students walk in the shoes of someone that is aging. So you can find free dementia scenarios if you search online. They're out there. So today we've tried to do some of that research for you and save you some time. Now I'm going to be sharing 2 from the Alzheimer's Association that feature 2 different stages of Alzheimer's, which is just one type of dementia. Now you could share this scenario that you see on the screen here with your students, having them role play with individuals or as the individual, that middle stage of Alzheimer's, and then your other students could be family members or even healthcare workers to give them, a variety of perspectives. Now, here is the second late scenario from the same source, but this features a scenario with late stage Alzheimer's. Again, you could have your students role play this as well. You could also challenge your students to read a list of words, perhaps more than 3, and then remember them after showing them the list for only a short time. And even an activity like that, your students would experience the sense of urgency, frustration, anxiety, and maybe even more. So little things you can build in to give them that personal experience. Now, here's a scenario that features vascular dementia. And one activity you could do with the dementia scenarios is to create or find scenarios for different types of dementia. Alzheimer's, Lewy body dementia, frontotemporal, vascular dementia, and mixed dementia. You could assign each small group one type of dementia scenario to role play and to debrief with. As a class, you could even compare and contrast the signs that are in the scenarios and how they differ between each of those 5 types of dementia. Now, a quick internet search will unearth a multitude of free dementia resources. And here is one. It's the Dementia Simulation Toolkit by the Ontario Centers for Learning, Research, and Innovation in Long-Term Care. This is terrific. It's a 61-page document, including 8 different scenarios. What a goldmine of information. So it's a toolkit that includes information for facilitators regarding dementia. There's some dementia simulation techniques and even sample scenarios based on common experiences of the elderly in the healthcare system. They even have some suggestions for additional modifications you can make to the scenarios. And then there are debrief questions as well. So a toolkit like this would allow users to identify and use dementia simulation techniques and scenarios to engage your students in a reflective and also give them deeper understanding of dementia. So that was one I thought would be a really good source. Here is a one-page Alzheimer's simulation put out by the Alzheimer's Association West Virginia chapter. And it's helpful in that it easily identifies the materials that you need, the steps to prepare, and then what you need to do. So a quick and easy Alzheimer's simulation there. Now, videos can be a very powerful source for dementia simulation. And here are a few that we found on YouTube. Now, link number 1 is from the Alzheimer's Society, and it's from the point of view of someone living with dementia. The second link illustrates the behavior of a person who's agitated and behaving aggressively. So it then demonstrates ways that healthcare professionals can help to manage a person with dementia when they exhibit that aggressive behavior. And then the third link is really a unique app, and it's designed to put you in the shoes of someone living with dementia. And you can go to that link and see clips from that experience, from that point of view. And it's, again, a really, really good source for that aha moment. Now, using scenario-based learning to walk in the shoes of an elder abuse victim. Well, the first best practice we want to share today is to make sure your students are clearly able to define just what elder abuse is. You could search for or present information about the 5 different types of elder abuse that we have listed here. Be prepared. Your students are really going to be shocked and horrified that this is even a thing. Some of them are not aware. And you could use prepared scenarios or even create your own that highlight or focus on each of these types of abuse to help your students understand what it is. So helping students learn to identify each of the 5 types of abuse is really important because there are different warning steps for each of the 5 kinds that students can learn about, because being aware will enable your students to know it when they see it. So screening tools like medical evaluations of patients suspected of being abused is necessary because medical and psychiatric conditions can sometimes mimic abuse. And signs of abuse also may include specific patterns of injury. So interviewing patients and caregivers separately is another good practice. You're going to evaluate for potential abuse. And when you do that evaluation, it should also include assessment of cognitive function. So just from that, I'm going to go back for just a second here. You could weave in some questions that come from the Elder Abuse Suspicion Index. And that's an index that is validated to screen for abuse in cognitively intact patients. So here are 6 questions that you could use to create a scenario from that index. Some of the questions would be, have you relied on people for any of the following? Bathing, dressing, shopping, banking, or meals? Has anyone prevented you from getting clothing, food, medication, glasses, hearing aids, or medical care, or from being with the people you wanted to be with? Have you been upset because someone talked to you in a way that made you feel ashamed or threatened? Has anyone forced you to sign papers or use money against your will? Has anyone made you afraid or touched you in ways that you did not want or hurt you physically? And then here's something specific for physicians. Sometimes elder abuse can be associated with findings such as, poor eye contact, a withdrawn nature, malnourishment, even hygiene issues, certainly things, cuts and bruises. You can ask, did you notice any of those things in the last 12 months on this patient? So you could create a scenario that highlights some of these types of questions and see how students react in a role-playing situation. Now, another example of best practices is to teach those warning signs. And you could share these warning signs with students. These are specific to physical abuse, but signs of elder abuse can certainly be challenging to recognize or mistaken for symptoms of other types of health issues at times. So scenarios including one or more of these warning signs could help your students learn to see them and recognize them for what they are. You could share with students that if you suspect abuse but aren't sure, you can certainly look to these warning signs. Now, another thing you want to be covering with your students is how to report suspected abuse. And just here are a few tips. Certainly call 911 if there is immediate life-threatening danger. However, do not confront the alleged abuser because it may make it worse for the elderly patient until the help can arrive. So just here are a few places that they could call, sources. that are listed on the screen here. But to reinforce these tips, you could create scenarios that involve reporting as a part of the scenario. You could leave the script or the scenario open-ended, asking the students what they would do next. Now, after using scenarios to reinforce identification and reporting, share sources of where you may also go to. So the first link that we wanted to share is an interactive map that will take you to each state and the information about reporting elder abuse in that state. So kind of a one-stop shop. The second link, the Elder Protection Center, provides state-specific elder abuse hotlines. And then the third link is on the Government Health and Human Services website and takes you to an elder care locator, and it links you to community resources to help. So all of those are just great places to go for additional help. Now, if you're looking for lesson plans, we've got some things here for you. The first link is to a 1-hour lesson on preventing, recognizing, and reporting abuse. And the lesson includes things like objectives and background information and also handouts. The second link is a slide presentation, and it's specific to nursing students, but it includes 53 slides and just has a real wealth of information. Our third link is that Elder Abuse Awareness Teen Kit, and it focuses on the World Elder Abuse Awareness Day. So there's a kit with all sorts of materials and suggestions for teens to create an awareness on that date. And then the very last link, the NCEA, is the National Center for Elder Abuse. And there is an education portion on that website, and it is a real goldmine. It has things like video, curricula, and also many different slide presentations. So now let's take a look at our dementia simulation experience. Now you can use the RealityWorks dementia simulation experience to help your students understand the effect of dementia and how a person with that can feel, how to care for them, and communicate with individuals suffering from a dementia-related condition. So this is a simulation, immersible simulation kit, and it has enough supplies for up to 20 students to experience a dementia simulation simultaneously. And it includes a curriculum with 10 scenarios, and it has 6 different lessons. Each lesson focuses on 5 different types of dementia. So you've got Alzheimer's, Lewy body, frontotemporal, vascular, and mixed. And here are just some of the benefits of the program. First of all, it's a very easy supplemental kit. So if you wanted to integrate a 1-week unit on dementia and make it very engaging for your students, this is a very easy way to do it, because your students will walk in the shoes of someone with each of those 5 types. They'll also be able to role play in the role of a caregiver or family member. The simulation kits that are included, there are 10 of them, so you pair your students up for each of the scenarios. But the scenarios there's scenarios for all 5 of the conditions, but then there are 2 scenarios for each of the 5 types. One is in a home setting and one is in a care setting, like a medical setting. And there are even audio tracks provided. You put the headphones on and you're surrounded by the ambient noises that are matched to the scenario that you are now experiencing. So we've tried to make it. Furthermore, you've got some glasses that are going to be like confusing when you have them on, and you're also going to have some tactile sensation that's been dulled. But the scenarios include everything the instructor needs to set up the environment, brief the students, conduct the scenario, and also debrief at the end. So there's just a lot of good stuff in that little kit. We wanted to kind of pull out just one of the scenarios so you could see what it's like. So here's one. It's for frontotemporal dementia, and it's in a home care setting. So it gives you all of the roles you're going to assign, all of the environmental things you're going to need to set up. It briefs you on kind of the context of the scenario, gives you an overview, and then there's even a script that can be loosely followed. Or if you want to keep it more free-flowing, you can, but there's kind of everything you need to have your students go through the scenario. So how that would work, you choose the scenario, and then first of all, choose from which type of dementia you wish to do, and then the type of scenario, the environment. Do you want the home care setting and do you want the medical? You could have your students go through both and switch after they've had the chance to experience both. So there's a lot of different ways you can implement this, choose what works for you. And then each of the scenarios we're estimating would take maybe 10 to 15 minutes, including all the pre-brief, the orientation, the scenario itself, and then switching roles. So if you wanted to do both scenarios for each condition, it might take an entire 1 hour class period. So you can, again, pick and choose what works for you. As far as the curricula goes, you've got lessons on each of these different types of dementia, as well as just a general introduction. Each one also comes with slide presentations and lecture notes. So even if you knew nothing about dementia, you would have everything you needed to be able to teach on that topic for the lesson day. So let's jump over to a different new kit we have. It's our Elder Abuse Training Kit. And this particular kit introduces your students to the 5 different types of elder abuse. It's a very unique kit because it addresses risk factors, how to identify and report abuse, how to prevent it when it's possible. Now, we have 8 different kind of what we call wearable wounds that you could adhere to a mannequin or even to people if you're going to role play with your students to create those realistic scenarios. So the skin condition models just put you even into a more realistic scenario, if you will, of a vulnerable person. The curriculum makes it very easy to teach, and when you get done with it, students will really come away with more empathy and hopefully be able to understand just what elder abuse is. And then there's also a set of scenario cards that we include 5 scenarios for each of the type of elder abuse and neglect. Again, it's very good for critical thinking, problem solving, team building where you can think, pair, share. A lot of different ways you can use a scenario card to have some great classroom discussions. So we wanted to pull out a few of those scenarios and provide them to you because you could use these in your own classroom. And this particular one focuses on physical abuse. And you can see the scenario there. Mary is a resident at a skilled nursing facility where you work as a medical assistant. You show up to work one morning and are assigned to take Mary to the beauty salon for her weekly appointment. While transferring Mary to her wheelchair, you notice several abrasions and skin tears to both of her arms that were not there 2 days ago when you took Mary to her exercise class. You ask what happened to her arms, and she tells you the CNA who was helping her with her daily routine got a little rough. So then you are also provided with several key questions that you could use for discussion. You could also turn those into a writing activity. Here is another one of our scenario cards. Now, this particular one focuses on financial abuse. Again, you can see the scenario is not long, but you could have your students read through that and go through those key questions. Very rich discussion can follow something like this because many students aren't aware that things like this are even happening. Now, we also do have some workbook activities from the kit, and here's a scenario and an extension activity taken from our workbook that you could try with your own class. And this one focuses on a very tough area of elder abuse, and that being sexual abuse. And the written activity, after you get through the scenario, says research and write a document with information for an educational pamphlet for all residents and family members relating to that. So that gets a little deeper into the topic as well. So now we're going to look at some more free scenario resources that we have found in our research. Of course, we love the videos. So the first link is to 5 scenarios to share about elder abuse. The second link also includes a total of 5 scenarios. The third link is an awareness video that has just a lot of good information. And then link number 4 has 4 different scenarios. And we know that videos can be a very impactful way to introduce the topic to students. Scenario-based learning is also especially helpful to get your students to walk in the shoes of a vulnerable adult as well as a mandatory reporter. Now, here's another set of free scenarios that we found specific to elder abuse. The first link has 3 scenarios with questions specific for nursing students. So if you are in the health science part of the house or school, that might be one that you'd like to go to. The second link from the Alberta Elder Abuse Awareness Council provides 2 scenarios. One is physical and one is emotional abuse, and the other one is emotional and psychological abuse. Link number 3 for elder abuse indicators and examples. It's a document from Marquette Law School that includes several different elder abuse scenarios as well. and as it pertains to legal issues. And then the fourth one, the elder abuse case studies, has 5 different case studies that your students can read through and dissect. So you can see you don't have to look far to have a whole lot of ready-to-use resources for you. Now we're going to jump to dementia and where you can find more dementia scenario resources. Now, the first link, Tom and Barbara's story, comes to us actually from the UK. And when you click on the link, it provides you with a 19-page document that shares very in-depth dementia case study that could be shared, and it could be used for your students to debrief and discuss. The second link, the Dementia-Friendly Toolkit, is from UW-Madison, and it's developed with input from family, caregivers, dementia-friendly community groups, and healthcare experts. And it's a toolkit that has 6 multi-role simulations. Now, each of those will reflect common challenges for people living with dementia, and some of them involve things like a bank, a clinic, a restaurant, grocery store, telephone, and it helps build communication and advocacy skills to respectfully engage people living with dementia. And the toolkit also includes facilitator and discussion guides and how to have additional information about each scenario and links to community resources. And then the third link on this page, Dementia Care, comes to us from UCLA. And it includes a brief scenario with 2 supporting videos, one in English and one in Spanish, about repetitive questions. So you can see a wide variety of resources available when you look. Now, we are not done with all the freebies. We've got a few more free resources from RealityWorks we would like to point out to you today. And one is our free career exploration lessons. We have many. And if you go to the link that you see on the screen ahead, there are several sets that relate to elderly and aging individuals. We have the Health and Human Services that certainly does. We have health science, and there are also some facts career exploration, but then we also do get into specific therapeutic services career exploration. So if you're looking for lessons on those, there's 15 to 20 available for you. And we also do webinars on a monthly basis, just like the one you're participating in today. If you find a topic of interest, you can register for free. You'll get the download, the links, and all the resources we share. And then everything is also archived and recorded. So you can go onto the webinar link at any time and search through archived programs to find more topics of interest. And then, of course, we have some infographics we like to share. They are on things relating to healthcare and family and consumer science, and there's some examples on the screen. At the link, it will show you how to print those out. You can put those up, and those can provide some great sources of information for your students to look at. And then we also have some free implementation guides, and the ones I listed here are the ones that most closely align with the content today on elder abuse and geriatric or dementia type programs. So if you're looking for some implementation guides on how you can start up pathway programs and types of resources and skills trainers and such that would be available to you from RealityWorks, those are a terrific starting point. And then one more mention is our social media. We try to be busy on many different social media platforms, and here's just a few. But we constantly updating them with guest writers, trends, new product launches. So if you're looking for some very vibrant and active social media communities, these are some great places to go to. So I've been giving you a lot of information over the last half hour, and I know Emily's been watching our chat box. So Em, at this time, I would open it up to Q&A for any of the things we've shared today.
Awesome. Thanks so much, Denise. Folks, if you have a question or a comment to share with Denise, you can use either the chat feature on your screen or the Q&A button as well on the bottom there. I'll give everyone a moment or two to type away if you have a question or concern to share. In the meantime, boy, Denise, it's been really fun as you've been chatting to just gather some great positive feedback as you're sharing all these video links and resources. It sounds like several of our attendees are appreciating those already. And boy, we've got folks from all over, Kentucky and Louisiana to France. So
Oh,
very
wow.
fun.
Okay. Well, that's fun. Yeah, it is really surprising once you start to do searching for ready-made free scenarios and simulation ideas, what you can find. And I always like a good research project. So this was a really fun webinar to prepare for.
That's awesome to hear. Thanks, Denise. Karen saying great information. Thank you. Alexandra saying thank you. Folks are thanking. I'm not seeing any specific questions on products or resources. Lots of thank yous and positive feedback.
Oh, great.
Looks like we don't have any specific chats either. So,
Okay.
folks, if you have any questions or concerns that you'd like to share, feel free to reach out to us. You can email us directly at information@realityworks.com, or when you get that follow-up email in your inbox within the next day or so, you can reply to that as well with any questions. Oop, it does look like Janelle. Oh, yep, sure enough. If you missed the beginning, actually, Janelle, great reminder. Let's reiterate what everyone can expect via email over the next 24 hours. So we will be sharing a copy of this recording so you can watch the replay anytime. We will share Denise's slides as well as all of the links and resources that she shared. So folks will be able to access that as soon as they receive that email within the next 24 hours. All attendees will also receive a certificate of completion that you can use for any professional development purposes as well. And again, any follow-up questions, you can contact us directly by replying right to that email or visiting our website.
Well,
Also,
thanks,
still
everyone.
getting positive feedbacks flooding in, Denise, but no specific questions.
Okay, well, thank you everyone for spending the time with us. We hope you found a few things that you can try right away. And just to beef up the engagement, and those two topics are just so very, very important for your students to understand, especially if they're going to go into related occupations. So thank you very much, everyone.